The specific cause of fibromyalgia is not fully understood, but researchers have found a bunch of connections to the disease. Genetic factors may contribute to the risk of developing the disease, so family history. Being a female over the age of 40, it is often triggered by an event that causes any physical or emotional stress, such as car accidents, infections such as Epstein-Barr virus or Lyme's disease, or any major operation. You are also more likely to get fibromyalgia if you have another painful condition, such as rheumatoid arthritis, systemic lupus, ankylosing spondylitis, back pain that doesn't go away, and or irritable bowel syndrome.
In order to diagnose fibromyalgia, clinicians look for a set of symptoms that are agreed upon by experts in clinical studies. Fibromyalgia is diagnosed when the patient's symptoms meet the criteria and all other diagnoses have been ruled out. A person with fibromyalgia may exhibit the following signs and symptoms, like chronic pain, which is developed in numerous parts of the body and lasts longer than 3 months, that overwhelming feeling of tiredness, having trouble sleeping. They'll be feeling tightness in the joints and muscles. A person will be extremely sensitive to pressure. So, for example, if I were to just brush past somebody with my shoulder and they experience severe pain from just a light touch, that's an example of sensitive to pressure. They'll feel numbness and or tingling in the upper and lower extremities. They'll have problems concentrating, thinking clearly, and even sometimes memory, and this is what's called fibrofog. They'll have a high sensitivity to light, noise, sense, and temperature, and that's because of the central nervous system being affected, which makes it difficult for our brain to process pain and sensory information. Furthermore, patients may also experience bloating and constipation as a sign and symptom of fibromyalgia.
There are a few key risk factors for fibromyalgia. The first one is gender. So, fibromyalgia is much more likely to occur in women than in men. Age is another important risk factor, as fibromyalgia symptoms will tend to present between the ages of 20 and 50. Family history may be a risk factor because it is believed that fibromyalgia is hereditary and a genetic condition. Physical inactivity, being overweight or obese may also be risk factors that could make you more susceptible to fibromyalgia. Insomnia and other sleep disorders may increase your risk. And stress might be a major risk factor because it is thought that stressful events can trigger an onset of fibromyalgia symptoms. That could be emotional stress or physical stress. And the presence of other prior painful conditions may also be a risk factor that could make someone more susceptible to fibromyalgia. Specifically, autoimmune diseases such as rheumatoid arthritis, lupus, and also osteoarthritis may increase someone's risk of having fibromyalgia. There are currently no specific imaging or lab tests to diagnose fibromyalgia on their own. A doctor is going to want to gain a thorough understanding of someone's medical history in order to accurately diagnose fibromyalgia. They will want to rule out other possible conditions that might be able to be identified through lab tests such as blood work or imaging. So if other conditions such as rheumatoid arthritis or osteoarthritis are not found, a doctor might more easily be able to diagnose fibromyalgia. They will perform a physical exam where they'll examine joints and other areas of reported pain by the patient. And widespread pain all over the body is really a red flag symptom for fibromyalgia that might signal a doctor to diagnose the condition.
Medical treatment focuses on managing symptoms and improving quality of life. Some key components included medications like pain relievers, antidepressants, anti-seizure drugs to reduce the pain and improve sleep. Physical therapy with tailored exercise program will help enhance strength, flexibility, and stamina. Cognitive behavioral therapy is also effective for addressing pain, emotional challenges, and stress management. When treating a patient with fibromyalgia, a rehab therapist, whether an occupational therapist or physical therapist, must be cautious about several factors to ensure effective and safe care for the patient. Firstly, it's crucial to avoid overfatigue by carefully placing activities and exercises, as patients with fibromyalgia often experience heightened sensitivity to pain and fatigue. Therapists should also monitor the patient's pain levels and adjust to the intensity of the exercises accordingly, ensuring that the activities are manageable and not exacerbating symptoms. Regularly monitoring blood pressure and heart rate is very important, as these patients may also have autonomic dysfunction. Therapists should also focus on gentle, low impact exercises like stretching, swimming, or walking, relaxation techniques to help manage stress and promote better sleep patterns. And lastly, patient education on energy conservation techniques and ergonomic strategies can help reduce strain and improve daily functioning.